KNKX. Combating the coronavirus outbreak goes beyond local and state agencies. The federal government's response was front and center at a hearing of the Senate Health, Education, Labor, and Pensions Committee. Washington Democratic Senator Patty Murray is the ranking member of that committee, and in her opening remarks yesterday, she said the Trump administration's response to the coronavirus outbreak has been underwhelming.
The administration has had months to prepare for this, and it is unacceptable that people in my state and nationwide can't even get an answer as to whether or not they are infected.
After the hearing, Murray spoke with KNKX All Things Considered host Ed Ronco. He began by asking her about the assurance of transparency from the federal officials and whether she left the hearing feeling better about the administration's response.
Public trust of these individuals in this kind of environment is absolutely critical. I can say it is really distressful to me that we have to ask those kinds of questions at a time when people are really counting on everybody to give them the information they need.
So I want to ask the what now question, which is, a hearing is one thing, but what happens next to actually move things forward?
Well, I am pressing everyone at every one of the agencies, from FDA to NIH to CDC, to move quicker than they have to get the tests out to our communities so that we can make sure that everyone who is exposed or experiencing symptoms gets tested. Right now, people are acting on information without having the facts, and that is a challenge to families, to businesses, to community leaders, to everyone. And without the tests and without the facts, it's really hard to make really tough decisions right now.
I know Governor Inslee said earlier today that he's asking the federal government to make sure they free up stockpiled equipment like masks and respirators.
Correct.
And those kinds of things. Are there federal efforts to ensure that local communities have what they need?
Well, the governor has been able to get from CDC some of the stockpile they have for what we call personal protective devices. But there is going to be a need for more, not just in our state, but across the country. And we do not have them in stock right now, which means that CDC and other agencies have to be pushing private industry right now to get those developed. And that's what we are focused on telling them.
If we get to a point where businesses are closed temporarily and people are unable to work, are there plans for emergency financial support to help individuals deal with an escalation like that? This could be disruptive to a lot of lives, even if people aren't diagnosed.
Well, absolutely, and it's what I have been telling the administration at every level, at every agency, including the vice president today, that you can't. What they're telling people today is, if you feel sick or think you might have been exposed, to stay home for 2 weeks. There are people who can do that. There are a lot of people who cannot, especially low-income workers, hourly wage workers, people who are, counting on that paycheck. And today, because this country is one of the few that doesn't have paid sick leave, there's a lot of folks out there that don't have access to the ability to make sure that they can get paid if they stayed home. It would be great if all of the industry companies in our country said at this time they were going to step forward and make sure people are paid if they can't be at work. But I can tell you right now that's going to be very hard to be implemented, with a lot of small businesses, for example, being impacted.
All right. Senator Patty Murray, thank you so much for your time.
You bet. Nice to talk to you.